Maggie's a great lady. She's 66, but she's about as spry a 66 as you'll meet. She runs marathons. She was set to run a marathon not too long after I saw her for her broken wrist. She does Pilates, and she took a fall back in mid-July.
I put my foot on my computer bag, and I wobbled and I came down on my wrist.
So she had a fracture which went right across here within the radius bone.
He did the x-rays and he said I had a fracture of my wrist and I would have to have surgery.
It used to traditionally be treated primarily in a cast. All right, so what we've moved towards a lot, especially in more active or even folks a little bit on the older side like Maggie, who are still very young, is going ahead and surgically fixing them when they're displaced or out of alignment. And for a lot of these fractures is something called volar plating. It's a nice option because it's this small metal plate, as you can see here, all right? And this plate is actually engineered to be the exact shape of the distal radius. There are several manufacturers that make them, but just through a small incision on the undersurface of the wrist, so it's usually about 2 inches long, just goes from about there to there, we're able to set the fracture back in position. Instead of being brought back, we can then fold it over the top the way it's meant to be, and then we put on this strong plate and screws on the undersurface of the bone.
He said, you know, I would recommend as an active person that you have surgery.
From a patient perception standpoint, they definitely like having some more mobility and more freedom and not having to be in a cast and be restricted. And then they start moving earlier and potentially get back to function faster. She did very well. By about 10 weeks post-surgery, she already ran a marathon and she was back to her former self.
Dr. Wysocki is incredible, he's approachable, and I've had a phenomenal result.